All right, so after yesterday and after some of the talks today, if you're feeling a little bit stressed, there's some techniques coming your way to help you manage that. Hema is a fellow podiatrist, and it's really, really cool for me to share the stage with her. She's been very actively involved in the teaching of podiatry for a whole number of years. She has worked in the public sector as a podiatrist as well as private sector. But beyond actual clinical practice, she is an advanced breathwork practitioner, I got it right, and a yoga teacher. And with that, she's got techniques that she's going to share with us about how to manage some of the stressors and burnout that we deal with every day. Welcome, Hema.
Thank you, Megan. All right. Thanks, Megan, for the introduction. Can you hear me all? Okay. And thanks to the organizers for giving me this platform to invite me to speak on such a personal and professional topic. Before we start, I thought we could break out in a little bit of a song and dance, but you can sit, you don't have to stand up if you don't want to. All right, so just follow the prompt, you don't have to do really much. So let's go. Sorry, technical issue there.
You're gonna be okay.
Can we go back?
Loud in your mind, just
Can we
take.
go back? Okay.
Puff out your chest, take a deep breath. You're gonna be okay. Is it loud in your mind? Just take your time. You're gonna be okay.
Come on, everybody.
Puff out your chest, take a deep breath. You're gonna be okay. Is it loud in your mind? Just take your time. You're gonna be okay.
Guys?
Puff out your chest, take a deep breath. You're gonna be okay. Is it loud in your mind? Just take your time. You're gonna be okay.
Come. Last one, with
Puff
purpose.
out your chest, take a deep breath. You're gonna be okay. Is it loud in your mind? Just take your time. You're gonna be okay.
Ooh, wonderful. Thank you. Give yourself a nice clap. Okay, awesome. So we're talking a lot about AI, and in a world of automation, documentation, artificial intelligence, the breath still remains profoundly human. Technology supports our work that we do, but care, presence, and awareness comes from the clinician. So clinicians are trained to observe posture, pathology of others, but they rarely notice or pause and find the rhythm of their own breath. So we are faced with a lot of pressures in healthcare, but we can't change that, but we can change the way our body responds to these pressures. So in every interaction, whether we with a patient, starting a consultation, looking at notes, we always met with this quiet, easier, or first quiet encounter. That's our breath. Okay? It's the simple breath that meets before anything else does. So I thought, let's do a practice and meet ourselves at our breath. Okay? So just take a moment while you're here. Okay? Just settle in. So if you could just put both your feet flat on the ground, feeling the backrest of the chair, and just take a moment and getting settled in. We're going to take 3 conscious breaths together, and it's called the physiological sigh. All it is just 2 consecutive nose inhales followed by a long exhale. So I'm just going to demonstrate, and then we'll do 3 together. So you'd inhale, take a sip, and then you'll exhale through the mouth. All right, so let's do that. Inhale, take a sip, and exhale. Long exhale, then the inhale. Inhale, inhale, and exhale. Okay, one last one. Inhale, sip, hold for a moment, and gently exhale all that stale air. Just notice for a moment. Is there a little shift? Maybe just slightly? A little jaw release, or a little bit shoulder, or you're just feeling a little bit sense of ease? it is that it's a reboot button, a quick nervous system reflex. A reset. And it triggers or just deactivates the stress response, creating a sense of calm and bringing you in the present moment. And yes, just like the yawn also has a similar physiological effect. And this is a natural body reflex. So the body is rebooting its system naturally throughout the whole day. So when the next time you decide I need to yawn, open chest, full yawn. Okay, let's just try one. Okay, let's just mimic this. Okay, just entertain me. Okay. Okay, and just see if anybody did sort of yawn. And if you did yawn, there we go. It's the mirror neurons that are the guilty ones, not me. So what we're going to explore today is what stress and burnout is, impact it has on our body and breath, maybe identify or going away with some practical tools that can assist with us in this journey, looking at where or identifying where our energy levels are at, looking at the art of breathing framework to assist us in the micro shifts, and looking at micro signals and micro shift, understanding how we can implement this in our clinical work. So stress in the body. Over the day or the clinical day, stress quietly creeps in. Do you notice this? Do you notice this micro signals? Maybe a little bit tension in the body, the neck stiffness, or maybe a tummy, a little bit tightness, a headache. And these subtle things go unnoticed most of the times. So where are you carrying that things that are going unnoticed? Okay. So just to find out where we're keeping that stress, we're going to try another exercise. It's a tension release exercise. Okay, and we're just going to explore it short. So all I want you to do is I want you to start at your hands. Okay, and you're going to scrunch it. So I want you to do it gently, because I don't want anybody going into a spasm, because in case you haven't used that muscle for a long time. So you can start with your fist and just scrunch it, scrunching your forearms, your elbows, your shoulders, your knees, your body, your belly, your stomach, your face. Just hold it for a moment and see if you can take a deep breath in while holding this. Are you able to, or is the breath stuck? And release. All right, we're going to do that 2 more times, right? So inhale, and then scrunch up the entire body, starting from the feet or wherever you feel. Tighten, tighten, tighten. Hold it for a minute. I mean, just for a second. And let go. All right, so at least it's listening. And we're going to do one more time, and we're going to hold it a little bit longer than a second. All right, so let's begin gently. Scrunch up our wrist, our forearm, our shoulders, our belly, our neck, our face. Scrunch it as tight as you can. And release. All right. Are you noticing some subtle changes? Maybe with a bit ease on the muscle. Maybe you're breathing. So this is a progressive muscle relaxation exercise. Okay? It releases built-up tension, so physical stress, muscle tension. It enhances breathing freedom. You're allowed to breathe better. It releases the diaphragm. Gives you bigger time to sort of expand. It resets the chronic stress and enhances body awareness. So your interoceptors, your internal body sense. Okay? So early awareness of micro signals and regular body and breath check-ins help prevent stress buildup and builds resistance, because that's what we're looking for. So what is stress and burnout defined? Okay? So what is stress? Stress is a natural response to demands and challenges that we have daily. But burnout is that chronic, unmanaged stress. So if we're looking at a stress cycle, a healthy stress cycle, because we must go through stress, okay? It rises with the challenges and demands of the day. And it can resolve if we, have a nice rest, or we have recovery loops, or recover with certain things that we can do. Like when Penny was talking how the bee has to rest for 5 to 8 hours. Do we get that rest? And if we do, we can reboot and the body returns to calm. But if it's unresolved and it's a continuous cycle, the chronic stress eventually becomes the burnout. So it was officially identified by World Health Organization, and they classified it in the ICD-10 classification as an occupational phenomenon resulting from chronic, unmanaged workplace stress. And they further characterize it as exhaustion, so you're getting your physical, mental depletion, your mental distancing, so you're trying to become like cynic away from your work or finding it not satisfying, and reduce professional efficacy. Okay. So question I ask you, have you ever noticed that the work hasn't necessarily changed, but the capacity to meet it has? So prolonged unmanaged stress without recovery drains your capacity, creating a reinforcing cycle that leads to fatigue, reduced functioning, and burnout. So, okay, I'm not going to go through this perpetuating cycle of stress. It will take me a bit too long, and I will become stressful. So I think if you need, we can talk about it a little later, but you can see this perpetuating cycle. So stress and burnout are alarmingly high among the health professionals globally, showing significant consequences in the individual, the organization, and in patient care. So I didn't do a lot of stats. I mean, I did, and I did use AI, but just to understand the broader picture, burnout globally in nurses and doctors, it's reported from at least about 40 to 80%, and in South African doctors, up to 84%. Okay, so there is still room. I mean, it's been a long time that they've been doing this research, but more has to be done. Okay, workplace pressures and insufficient recovery amplifies the stress-driven exhaustion, and burnout affects clinicians' well-being and patient care. So you start making little errors, little mistakes. You know, increased medical errors, low patient satisfaction, and then it reduces quality of patient care. So that brings us to another practice, okay? And this helps you to build resilience, and that's what we want, is to build resilience so we're able to deal with all these pressures and bring us back to sort of, if you can say, like a homeostasis type of place. Because I don't think I feel, even me doing my breathing and that, I haven't felt balanced in a long time. And when I say balanced, like just balanced and staying in that form. I mean, it's always the pull, the push, the doing. We've never been. So our ability to care for others begins with caring for ourselves. And strengthening resilience support, strengthening resilience supports clinicians' overall well-being. All right. So we're going to do the next practice is a simple one that builds resilience. It's called the coherence breathing. Okay, it's a rhythmic breathing where we're going to inhale for 5 and exhale for 5 through the nose. Okay, so we're going to do that. All right. So if I could invite you to sort of, if you do have anything on your lap, so put it on the side. So just comfortably placing your hands on your lap or on your knees, wherever it's comfortable. And adjusting your body, so making sure your legs are uncrossed, feet both placed on the ground, adjusting your spine, so not like leaning and like slouching, just touching the back but not leaning into it. So straightening or lengthening in the spine rather, allowing your head to balance over your heart and your heart to balance over your pelvis. All right? Just simple and be nice and relaxed, softening your shoulders, softening your belly. And if I may invite you, if you're comfortable, you can soften your gaze or even just close your eyes. Okay. So we're going to try a short practice, remembering to inhale and exhaling for 5. So at the moment, don't do anything, just notice. Just notice what's happening, adjusting your body, just observing what's happening from the feet all the way up, down. Are you noticing any tension? Or where is the breath sitting? Is it up in the chest, low in the belly, or is it in the ribs? bring your awareness to the breath itself. Be the observer. Just noticing as the cool air flowing from the nostrils all the way down, expanding your belly. And as that air comes out, that warmth on your top of your lips. Noticing the rise and fall of the belly, rise and fall of the chest. And now let's settle into this coherent practice. We're going to inhale for 5, exhale for 5 through the nose. So I invite you to begin with an exhale, so through the mouth. So inhale and exhale. Inhale, 2, 3, 4, 5. Exhale, 2, 3, 4, 5. Inhale, 2, 3, 4, 5. Exhale, 2, 3, 4, 5. Inhale, full belly, chest, shoulders. Exhale, all the way down, belly to spine. Inhale and exhale. Just continue with this rhythm, finding a pace that suits you. And as you're breathing, see, are you able to slow this breath down? Are you able to soften the body with every exhale? If the mind does drift, just bring it back to the rhythm of the breath. Inhaling and exhaling, creating a wave, no effort, just the breath. Gently slowing it down. Stop the counting and just allow the breath to return to a natural rhythm. And still staying in this stillness, just do the felt sense of noticing what's happening. Are you feeling a little bit more centered, more present? Are you feeling a little bit balanced? Because this is a balanced breath. And lower your chin to your chest. Blink your eyes open and take your gaze forward. Oh, welcome back, everybody. So just noticing that subtle changes. Okay? If anybody would like to share, we can take a moment. If anybody would like to say if they've noticed anything, any shift, or especially from before you came and now how you're feeling. Oh, thanks. So this is coherent breathing. So vagus nerve activation, it's a parasympathetic regulation, it's resilience built from the inside out. No trends, no gimmicks, just nervous system science. Okay, so this is science-based intervention. Okay, it's heavily researched. It activates the parasympathetic nervous system, boosts your vagal tone, lowers the stress hormones, improves heart rate variability. And it's also known as resonant breath, a balanced breath, coherence, what's another one I'm looking for? Paced breathing. But what I like is 365. It's also called 365 breath. And that's a good micro shift or a recovery loop that you can use in your practice, during your practice. And that is 3 times a day, 6 breaths per minute for 5 minutes. Okay? And I think that's doable in our practice, or even when you're at home or sitting and watching TV, you can do that. So I think the misconception of breath is with meditation, where you have to sit secluded, quiet, and just, I need to now breathe. No, you can do it anywhere. I did it while I was waiting here to come up because I could feel my nerves, butterflies, and I'm like, because my body takes over, and then it's difficult. Then you'll see the knees will be shaking, which you can't see right now, but the knees are shaking. So it's about using this most accessible tool whenever you need it, wherever you need it, and whenever you need it. Okay. So awareness of one's energy state and recognition of and signs of dysregulation are vital for self-care, building resilience, and supporting patients. Okay. So I will talk about my journey, but I'm hoping at the end, in case I have extra time, I can go a little longer, because as I think I'm friends with Tasneem, we are chatterbox. So I'm going to show you the next slide, but don't get overwhelmed. Okay. It's called the energy zone map. Okay. It's a lot of busy things, but all it is a self and patient awareness tool. All right? It helps clinicians identify their stress and energy patterns, okay, across these 3 zones. So you got the green zone, which is the optimal zone you expect to be. You've got the danger zones, which is the fight and flight, and the freeze zone, okay? And so you're able to distinguish your energy and stress pattern and also observe your patient, and so that you're able to be more informed and empathetic in your care. Okay. So it highlights your physical, mental, emotional, behavioral patterns. Okay? And it bridges the gap between nervous system, your breathing patterns, and your clinical well-being. All right? So yes, I know it's a lot you can read, but we're just going to do an overview. So if you want to talk more about this, I can have another lecture just on this. Okay? So our nervous system are constantly oscillating through these different zones, okay? And when you talk of the blue zone, that's the optimal zone where you are, the clinical daily stresses and the challenges. You go home, have a reboot, or you go on a holiday, you come back, and it just continues. But what happens is that when you get chronic stress, means it's extended, and then you tend to stay a little bit longer in either of the fight and flight or the freeze mode, and you don't have time for recovery, or there's no recovery loops coming in, you are going to tap into burnout. So this area where the optimal zone is the blue zone is where you're looking to create your resilience, where you want to build your resilient practices, like what we just did now, a breath practice, or any of those practices we did, okay? And why I say that, because if you look at the white dotted line, that is the window of tolerance where we want to expand. So as we're building our resilience in this green zone, we want to expand or widen this window of tolerance. So we're able to be able to manage stress more, or we're able to handle stress better and know when to recognize it and come back to the optimal zone. Okay? Any questions or anything? Nothing? Good. All right. So again, just the self and patient awareness, identifying clinicians' own stress and energy patterns. But what I want to say is that as the nervous system constantly oscillates, if you daily can notice these early micro signals, the tightness and the emotions, we can use breathwork as a simple tool to micro shift in that particular moment. So I love Penny's talk. I loved where, we can take out to nature. It's just brilliant. I mean, I'm a nature girl, okay? That's why I'm wearing green. But partly why I wore this is I wanted to match my slides. No, but true. It's very stressful sometimes when you a little bit on the ADHD spectrum where you can only function with certain. So this is me. So I thought I would match my slides. The pink was just an extra. No, I'm just kidding. But yeah, so the goal is, so as I was coming back to walking in nature, and there's so many tools, modalities that you can do to help yourself reboot. Things that someone might like to paint, art. Someone like to walk in nature. Someone maybe likes to read articles. For bedtime reading. It's whatever you enjoy, okay? But the goal is not permanent serenity. It's about adaptive capacity. It's learning to adapt when you need it. It's in that flexible zone, to build in that blue zone how you can be flexible to maintain that, okay? There's no straight line. It's, straight line is a dead line, okay? And one of the nicest thing is, I'm a yoga teacher, so I'm going to have to say that because that's what yoga is developed on animals. Have you ever seen a stuffed snake? Because it's a dead snake. All right? So keep moving. All right, so the same system that responds to the breath, responds to stress, also responds to the breath. So that means we carry the most accessible regulation tool with us wherever we go. And it's one of the only organs that you can actually control from the outside. Okay, you can't control your blood pressure, you can't control your blood flow, your heart rate, but you can with your breath. So you can control your lungs and the way you breathe, and that impacts on your nervous system. Okay? So looking at regulation versus flexibility, and the aim is about flexibility. Regulation is not being calm. It's about being flexible, dynamic. And so adaptation to the situation is important. And that's where breath work comes in. It adapts to the situation where you need activation, so you're feeling a little flat. You need activation for energy and focus. There's a breath practice that you can do, or breath practices that you can do. If you need to downshift your nervous system, you're in hyper, there's a practice you can do to relax and calm. And there's a breath practice that you can balance, and that's the one we just did now. It's the coherence breathing. It's to balance, just to come to an area of homeostasis where you can mentally, you can have clarity on your thinking. And cumulative, as I said, there is many, many practices that you can do to support you. And everyone, it's not one size fits all, okay? Like no one capsule fits all. So you can see what small consistencies of practices or actions you can use in your clinical practice. So that brings us to this art of framework. So art of breathing framework, okay? It's an ongoing design. It's by Breathwork Africa, Dr. Ila Manga, and this is what we sort of work our ideas on what breath we may use. So it's actually a structured approach to linking breath to the nervous system and the energy states. And 5 categories: awareness, energy, regulation, balance, and transformation. I don't know if you can see it very clearly, but if you're looking at awareness, what we did was placing our feet on the floor, just sitting up, observing our breath. That's awareness. That just brings you back into the present moment. Okay? Already activating your nervous system. Then you've got energy. Those are practices you can do to feel a little bit energized. And that's what we did. The physiological sigh, where we took hold and part of that energizing is also relaxes you. We've got relaxation practices like the humming, yawning. And the humming breath is just humming. Okay? There's different ways of practicing it, but all it does is stimulates your vagus nerve, increases nitrogen oxide, so you get better absorption of oxygen. We've got balancing breath, the coherent box breathing. Yes, box breathing. I'm sure you heard a lot about box breathing, and that's what exactly it is. It's imagining a box and you're breathing accordingly, but it's equal inhales by 4 holds, exhale, and by a 4 hold on the exhale. And they used to use that in the battlefield. That's where it came from. They used to use it before they went on the battlefield. And then transformation is a little bit more on the more guided side, and that cannot be done as an individual. It has to be guided by somebody, and that I hope it's happening to you right now, the transformation after my talk. Okay? So, integrating it in your clinical day, micro moments for self-care. So you can find where it works. It doesn't have to be like a staple of this is how I'm doing it, have a schedule. But I do have a schedule because I'm ADHD, so it's on my table. So, I'm flexible, so I'll move it, but that's my structure that I have to do one exercise, one breathing practice, one other things, but it's there. So, pausing or doing before a patient comes in, or maybe after, or you had a difficult patient, or you're going to be having a difficult discussion with a patient, you could do a few deep breaths. Maybe even do a breath with a patient. That's co-regulation. And co-regulation is the new buzzword. Okay? Intentional practices builds resilience. So mindful, constant practices. Okay? And then your nervous system. So think of breathwork as a personal hygiene for your nervous system. Like you wake up and you have to brush. It's just like that, using breathwork to look after your nervous system. And doing those micro shifts, so all these practices that we could do to support us throughout the whole day. So, as usual, I'm always fast, but the takeaways, so I'll have like an extra 20 minutes for my journey, but just a takeaway, breath work, or even the breath, use it as an anchor. So when you feel you're feeling a little bit frazzled, or you have to speak to somebody, and whether it's personal or in a clinical capacity, where take a deep breath, just center yourself, and it will clear what you want to say. Because we get really caught up in the thought than actually the doing. In the doing than actually the being. So stress and burnout are alarmingly high in HPC, healthcare professionals globally. And chronic unmanaged stress, burnout, gradually erodes your coping capacity and well-being. So early awareness of stress is the key. That's the micro signals before escalation. And you can use this energy zone map to see where you're picking up these signals. Nervous system regulation through micro shifts builds resilience, and you can use the art of breathing framework to help you. A lot of those you can do yourself, but it's always nice to just get somebody to sort of demonstrate it the right way and understanding exactly what it's used for, and then you can help. And it can be adapted. It's no right and wrong way. It's just what your system. Maybe today, I love, my go-to is a breath of joy, okay? Which I was going to do it, but there's no space. So that's my go-to. So that works for me, but if you tell me to sit and do coherent breathing for 10 minutes, I'm like, I can't get there. Okay? But I'll do a breath of joy before I get into coherence. So you can use what regulates you. So breathwork is a personal hygiene for the nervous system, the fastest physiological lever that influences the shift of the nervous system. And so small actions, daily, big impact, constant self-care practice enhances presence, resilient, and patient care. Okay? And he's testament to it. Nothing bothers him. Okay? So I thought I would end off with another practice, but that required you to take your shoes and socks off. And then I thought of the high incidence of vasovagal because of the bromhidrosis. So then I decided that no, we'd rather finish off with this 4 S's, okay? So if you can just entertain me, and this is quick. You can do it once, twice, thrice. So the 4 S's is a scrunch, a stretch, a shake, and a surrender, okay? So while you're sitting, just scrunch like how we did earlier. Scrunch, scrunch, scrunch. Okay, scrunches, scrunches, scrunch, scrunch, scrunch. And then stretch. So stretching your body. Left, right, you can do it for a few seconds. And then you shake. Shake everywhere. You can shake. You can even stand up and shake. And then just surrender means that's it. That's all you do. So you can decide whether you use this once, twice, thrice, and you can do it till you feel, okay, now I'm shaking this off. Okay? So I think you've got this, guys. You'll be fine. Okay? And there's assistance everywhere. Everyone does, what they're passionate about. I'm a podiatrist, and I'm doing breath work. And that's when it brings me back to my journey. And so I'm glad I've got some time, but I won't go too long. But everything starts somewhere. You say, why are you a podiatrist and why am I not clinical practice? And I've always been, I'm in the academic space, so I've started in academics and went into private practice and then clinical, and I've been in the private sector, the state. I've been everywhere. Okay, I've done research, and I'm doing breath work and yoga. My son always says, Mom, what is this woo-woo thing you're doing? Everyone breathes. What is this? Okay? So I said, okay, but my journey started when I was feeling that strain, when I was in university lecturing, and then I took a break, came back, and I was feeling the strain and not understanding. And then I even was telling my husband, I feel like my body systems are shutting down one by one. And I can't shake it off, and I'm just sit one place. And then a few trips, I went to the panic room. The emergency room for a panic attack. And came back and not realizing that I actually didn't even know who to go to. Because as clinicians, in healthcare, resilience means pushing through. So I didn't know who to go to, and you can't be vulnerable. Plus, I'm a lecturer, and I have to, I see patients, students, and I struggle, and then lo and behold, I was so glad that COVID hit. Okay? So for me, it was an opener for the world and myself. It did a number on me, but it gave me time and space away. Because at that point, I was busy with CPD events. So I was organizing this. A smaller scale, obviously, a very small scale, but still, the work is the same. And everything had to be online, and then I just didn't have the capacity. And I said, right. And I don't know if I went crazy or whatever, but it so happened that I registered for my yoga teacher training in February, and March COVID hit, everything closed. So we did it online. So I continued that. And so I had something to do and not just be idle. And then from that, as I decided to do my advanced Breathwork Practitioner course, because I'm thinking, what can help? And what can regulate my nervous system? So all this journey was for myself, not for others. Okay? And a lot of personal issues and whatever. And so those yoga and breathwork supported me. They were like lifeline tools for me that I use, and it helped me to reshape my life and reshape the way I show up for my family and for my colleagues and my peers. And so now that's what I do, is I show up for others and I try and support others to reconnect with themselves, to balance their nervous system, and to just, reconnect with compassion, or to recover with compassion. And that's where my passion sort of lies. So I'm going to finish off by this saying, which is, I love it. Almost everything will work again if you unplug it for a few minutes, including you. Okay? Stop, rest, breathe, start again. Each day is a reset, a clean slate, and a chance to meet yourself exactly where you are. You don't need to fix everything today. Some things will untangle themselves when you stop pulling so hard. Thank you, everybody.
Hema, thank you. We forget that we need to breathe. Was that interesting? Was that a good reminder, if nothing else, that just stop before you see your patient and breathe? Does anyone have any questions?
Thank you so much for the presentation. Just a quick question. Would you say the coherent breath technique is what we used to call in the past breathing exercises, only that now it has been refined and not so haphazard, so that it's structured to sort of deal with stress and burnout?
Okay.
One way or another.
So sorry, I didn't get the front part.
I'm saying coherent breath technique. It's a form of the breathing exercises that in the olden days used to be sort of...
So it comes from yogic practices, but it's also scientific in a sense where the coherent breathing is about balancing because of the equal breathing in and that. So you're trying to create equilibrium in your breath. Okay? And that's what so you're trying to, if you are in hyper and you, or either way. So I don't have that slide, but the aim is to get into that center point because you're tipping like this. And coherent is a very good method of bringing you back to that balance, the homeostasis. So you can use it, and sometimes you don't need that. Sometimes you feel, I just need to relax. And now I need, but you can't relax because your body is already in this fright and flight or mode. So you need to disperse of that energy first. So you can do an energizing breath and then to the coherent to relax. It's like, I can't meditate, right? I can meditate, but if my body state is at a good balance. So I do the breath of joy, do some dance. I love to dance. Sound is my vibe. So music and movement. Then I sit, because by then, I've already let go of all that dissipated, pent-up energy, and then I'm able to rest a little bit. I hope that answers your question. Okay.
Anyone else?
So this is just a bit off topic,
It's fine.
but I notice most of our patients have reflux issues, and breathing helps their diaphragm strengthen. So it's not just something where it helps you relax and get back to your zen, if you will. But I noticed that if somebody is a bit reluctant for a PPI, or somebody wants to go off their PPI, that breathing is really beneficial for that.
Awesome. No, thank you. No, that's for sure. That can be a topic on its own, the diaphragm itself, okay? If I could just go back and ask a question. When you notice when you are breathing, or when you breathe, where do you breathe? Do you breathe lower down? Do you breathe higher up? Does your shoulders? When you're breathing, okay, so you're using your accessory muscle, and I'm sure you struggle with neck and shoulder pains, okay? So when I see clients, so I do see clients on a one-on-one, and the first aim is not to learn breathing and how to breathe. It's about functional optimal breathing. Are you using your breathing apparatus, which is the lungs, the ribs, the entire, are you using it? Is your diaphragm working? Because the diaphragm is the primary function for breathing. Okay, so are you breathing? Some people breathe and they do the reverse breathing. They're inhaling, but their belly is going in. So the diaphragm can help not just your nervous system. It boosts your immunity. There's a whole bunch. Your blood, it's a whole thing. Which that's on a scientific base. I could do another talk on that. But yeah, thanks for that. Yeah.
You mentioned an interesting concept earlier on about breathing with your patient.
Yes.
If it's a whatever situation, and it makes me think in my practice, I do something similar like that before I'm giving an injection.
Yes.
Explain injection, what to expect, blah, blah, blah. Okay, needle ready. Breathe in, inject and breathe out. Not just for the patient, for me too.
Exactly.
And it's quite useful to do that before something that provokes anxiety.
So I think co-regulation, I said, is a new buzzword, right? And it is true. So when I was breathing and I was guiding you, if I was, okay, let's do this, and it would automatically. But I bet you that my voice allowed you to drop a notch down its vibe. So it works with kids, okay? That's where I start, because I used to be a kid and I needed regulation. My parents didn't know any better. But I did that with my son, because my son is, okay, he's 10 times me. So you can imagine. But I've learned to be able to, to be able to speak at a level with clarity and to say what you want to say, not what you mean. Sometimes we say things that we don't mean, and I'm just talking about life lessons too. Just co-regulating. So taking a breath. Especially someone comes in and they're hyper and they say, I almost have an accident, and okay, all right. And I use the sigh a lot. Okay, what happened? Tell me. So they can explain at a different level and they're not in arousal. So co-regulation is a really good thing. You can do with your patients. The minute they come in, when the patient's walking, that's when I start observing the patient, what state they're in. And that's why you can use this energy zone map of, assessing where they are at. Okay.
Hema, thank you very much.
Thank you, you're welcome.
I think that was quite a nice practical thing that you can do tomorrow in your first patient or maybe your 10th patient. So thank you for that.
Oh, no, you're
we
welcome.
appreciate you
Thank you
being
so
here.
much, everybody.
A small token of our
Thank you.
appreciation.
Thank you.
Cool.
Thanks.